Hello, my name is Scotty. I'm a student nurse with the University of Charleston in Beckley, West Virginia, and today I'll be talking to you briefly about the COVID-19 virus. We're experiencing a worldwide pandemic due to the coronavirus. COVID-19 is caused by the coronavirus, which is a large family of viruses that are common in people and a variety of animal species. Rarely, animal coronaviruses can infect people, then spread between people, but however, COVID-19 is included in that rarity. COVID-19 is a beta coronavirus, just like MERS and SARS. All three of these viruses have their origins in bats. Early on in Wuhan, China, patients at the center of the outbreak had some link to large seafood and live animal market. It is believed this is where this disease originated. So what exactly is COVID-19? It is a new respiratory illness that can lead to pneumonia and acute respiratory distress. The virus enters the respiratory tract and targets epithelial cells, causing damage to lung tissue and air-filled sacs called alveoli. As a result, the alveoli collapse, and the fibrous tissue fills the alveolar space. This may also cause pulmonary edema, which is fluid accumulation in the lung tissue, and pneumonia, which is an infection in the lung. Older people and people with severe chronic medical conditions may be at higher risk of developing a serious COVID-19 illness. If you have recently been around a person with known COVID-19 infection, you must report it to your local health department. You may ask, what are the signs and symptoms of COVID-19? The clinical picture of COVID-19 is not fully known. Typically, a person will have mild to severe respiratory illness with a fever, cough, and shortness of breath. In severe cases, they will have pneumonia in both lungs and multi-organ failure. If people have these symptoms, they should quarantine themselves and call their doctor, local health department, or local hospital to schedule testing and treatment. Now, how is COVID-19 transmitted? Well, as I stated earlier, COVID-19 is a coronavirus that originated from an infected animal but transmitted it to humans. It is then believed to be transmitted from person to person through respiratory droplets. If an infected person coughs or sneezes, tiny respiratory particles can enter the airspace and land on an object. If another person is within close proximity, less than 6 feet, they can inhale or ingest the infected respiratory particles, or they may touch the contaminated object and then touch their own mouth, nose, eyes, therefore infecting themselves. People are believed to be most contagious when they are having symptoms. As healthcare personnel, we must protect ourselves. The CDC recommends performing hand hygiene with alcohol-based hand rub before and after all patient contact with potentially infectious material, and before putting on and upon removal of PPE, including gloves. Some examples of PPE are isolation gowns, gloves, masks, N95 respirators, ventilators, face shields, and eye protection. Wash your hands with soap and water if your hands are visibly soiled. Assess and triage patients with acute respiratory symptoms and risk factors for COVID-19 to minimize the chance of exposure. Place a face mask on the patient and ask them to wait in an exam room with the door closed. Use standard and transmission-based precautions when caring for patients with possible or confirmed COVID-19. Practice how to properly don, use, and dispose of PPE in order to prevent self-contamination. And if you are sick, please stay home to prevent spreading the disease to others. Healthcare facilities can protect healthcare personnel by providing appropriate PPE to healthcare personnel in accordance with OSHA and PPE standards. Provide supplies for respiratory hygiene and cough etiquette, including alcohol-based hand rubs, tissues, no-touch trash receptacles at entrances, and in waiting rooms and exam rooms. Ensure that healthcare personnel are educated, trained, and have practiced the appropriate use of PPE prior to caring for a patient, including attention to the correct use of PPE and prevention of contamination of clothing, skin, and environment during the process of removing such equipment. Installing barriers to limit healthcare personnel contact with patients at triage. Ensure rapid, safe triage and isolation of patients with symptoms of suspected COVID-19 or other respiratory infections. Cohort COVID-19 patients by limiting the number of staff providing their care. Ensure that environmental cleaning and disinfection procedures are followed consistently and correctly. Require personnel to communicate information about known or suspected COVID-19 patients to appropriate personnel before transferring them to other departments in the facility, such as radiology or other healthcare facilities. What should you do if you've been directly exposed to COVID-19? You should undergo active monitoring, including restriction from work in any healthcare setting until 14 days after your last exposure. If you develop a fever higher than 100 degrees or respiratory symptoms like cough, shortness of breath, or sore throat, then you should immediately self-isolate and notify the local or state public health authority and health care facility promptly so they can coordinate consultation and referral to a healthcare provider for further evaluation. If you are sick with COVID-19 or think you may have COVID-19, stay home. Most people with COVID-19 have mild illness and are able to recover at home without medical care. Do not leave your home except to get medical care. Don't visit public areas, and if you share a home with other family members, isolate yourself to prevent spreading the infection to them. Stay in touch with your doctor. Call before you get medical care, and be sure to get care if you have trouble breathing or have persistent pain or pressure in your chest, have confusion, bluish lips or face, or if you think it's an emergency. If you do have a medical emergency and need to call 911, notify the operator that you have or think you may have COVID-19. If possible, put on a face mask before medical help arrives. Try to stay at least 6 feet away from other people. And avoid public transportation. Do not use public transportation, ride sharing, or taxis. Clean and disinfect high-touch surfaces such as phones, tablets, remote controls, countertops, tabletops, doorknobs, sinks, and toilets in your bedroom and your bathroom. Have someone else clean and disinfect surfaces in other rooms. I hope this helps explain COVID-19 a little better and how to protect yourself and what to do if you contract it. And this information and a lot more information is available from cdc.gov. Thank you.